Denmark and India healthcare system. We are Group 3 and our group members are Evangeline, Faithlin, Jenny, Kristen, and Sondas. Please enjoy our presentation. We will first be presenting Denmark.
What are the main goals and priorities of the system? The primary goal and priority for Denmark healthcare system is to provide universal decentralized healthcare coverage. The national government is to deliver health services to all its residents. As part of Denmark's health law, it promotes and provides population health and treat illnesses, suffering, and functional limitations to be able to ensure the best and highest quality care and easy and equal access, and to promote service integration, choice, transparency, access to information, and short waiting times. All registered Danish residents are automatically enrolled in care. Registered immigrants and asylum seekers are also covered. However, undocumented immigrants have access to acute care services through voluntary and privately funded programs. The programs may include the Danish Medical Association, the Danish Red Cross, and the Danish Refugee Council. In addition, in order to reduce health disparities, equity is focused on regional and municipal organizations of health and social care services.
How was the health system and the insurance scheme organized? In Denmark's universal decentralized health system, the national government provides block grants from tax revenues to the regions and municipalities which deliver health services. All residents are entitled to publicly financed care, including large, free, primary, specialist, hospital, mental health, preventative, and long-term care services. Denmark has free public care for its citizens and residents. The healthcare system is regulated by the central government, although most services are provided by the 5 regions' local governments. Hospitals and general practitioners are managed at a regional level, while nursing homes, home care, and school health services are the responsibility of municipalities. Only some specialized hospitals are managed centrally.
Insurance system coverage. Danish residents have two options for insurance. 98% of Danish residents choose the first option, which is patients need to see a GP who then gives them a referral to see a specialist. However, 2% of Danish residents do choose Group 2, which lets patients see a specialist without being referred by a GP. However, if they choose Group 2, they are required to pay a copayment. Group 1 and 2 insurance do require referrals in order for patients to check into hospitals. In the 1800s, universal coverage was non-governmental insurance, and it covered sickness funds and covered primary care.
Some conditions covered and not covered in Denmark include a general practitioner, access to a specialist, emergency care, medical assistance after hours, treatment at hospitals including surgery, admission, and aftercare, home nursing, and visits from a health visitor. Some things not included are medication, dental care, cosmetic surgeries, fertility treatments, physiotherapy, psychology, chiropractic services, and other non-medical or alternative treatments.
How is money raised for the insurance system? Cost containment is based on the healthcare outline in a budget law, which get budget for the regions and specifies an automatic sanction if the budget doesn't meet the guidelines. The budget law is supplemented by an annual agreement between the regional, municipal, and the state government to coordinate the policies for limiting spending on direct control on supplies. The performance of the regions are closely monitored, and the minor portion of the funding will be withheld and redistributed to technology development projects. The healthcare is financed mainly through the progressive national income tax that allocates healthcare funding to regions and municipalities, mostly to block grants with amounts adjusted for demographic and social differences. The private healthcare insurance are purchased by individual basis and usually are covered through exclusive non-profit organizations in Denmark.
Health services and payments. Approximately 22% of doctors are self-employed and work in general practices. 30% of GPs' income is paid by regions' capitations. The rest of the 70% of their income is from fees for services provided. The average salary for GPs is approximately $1.1 million, which would be $149,000 in US money. GPs are now allowed to charge extra for health services for patients that are in Group 1 insurance category. Nurses also provide services, are paid by clinics they work for. Nurses are in charge of taking care of patients with chronic illnesses, vaccinations, and drawing blood.
What share of health costs are borne privately for those who are insured? About 30% of Danes have supplemental insurance, which gives expanded access to private providers, mainly for physiotherapy and minor elective surgeries. 7 for-profit insurers sell policies that are given primarily through private employers as a fringe benefit. However, some public sector employees are also covered. Individuals who are not covered by supplemental insurance are students, pensioners, the unemployed, and other people outside the job market. This is the presentation on India.
What are the main goals and priorities of the system? According to the Commonwealth Fund, all Indian citizens can get free outpatient and inpatient care at government facilities. However, under India's decentralized approach of the healthcare system, the states are primarily responsible for organizing their healthcare services. For low-income people, the government offers tax-financed National Health Protection Scheme that allows them to get cashless secondary and tertiary care at private facilities. The Constitution of India obligates the government to ensure the right to health for all. Although India has been chronically underfunded, at the state level, Department of Health and Family Welfare are responsible for organizing and delivering health services to their populations. These services may include medical care, primary care, pharmacies, to secondary and tertiary hospital care.
India's healthcare system recognizes treatment for their citizens. However, it is severely underfunded, so only about 37% of the population are insured. Affordable medicines and services are mainly accessible to those with private insurance, so only 36% of the population have access. Quality care is defined by the state or central government. However, there's no clear entity of the quality of care for their facilities, yet there is a system. The National Accreditation Board for Hospitals and Healthcare Providers ensures that the quality care is provided in hospitals and facilities.
How universally does the insurance system cover the intended groups? In 2017 to 2018, only about 37% of the population was covered by any type of health insurance due to the public insurance schemes and the lack of utilization of commercial insurance. PMJ was implemented in 2018 to achieve universal health coverage in India. 40% of the population who was poor and low income had gotten hospital coverage. RSBY. Those living in low income are eligible for hospital care for most diseases and pre-existing conditions, with a family maximum of 5 members. In India, 36% of insured people have private health insurance that only covers hospitalizations. Conditions covered and not covered. The conditions covered depends on the insurance scheme. For the National Health Protection Scheme, secondary and tertiary care are covered, while outpatient care is not covered. For the Central Government Health Scheme and Employee State Insurance Corporation, all types of care, including outpatient care and drugs, are covered. For publicly subsidized insurance coverage, all secondary, tertiary, pre-hospital, and post-hospitalization treatments are covered. How is money raised for the insurance system? The federal government and state governments split the cost of public insurance plans. The majority of the states contribute 40% of the cost of the National Health Protection Scheme, with the federal government covering the remaining 60%. The National Health Protection Scheme is funded by the existing budget for the RSBY. State-owned enterprises offer full health coverage to their employees. The system has roughly 133 million participants, with state governments contributing 1/8 of the medical benefit expenses. Health services and payments. Primary health centers provide curative and preventive services. They may serve as a referral center and provide obstetric care and special consultations. Health and wellness centers provide maternal and child health, disease control, and health counseling. Medical personnel are paid fixed salaries based on area of work and level of specialization. There are no performance-based incentives, and accredited social health activists receive free insurance coverage. Private clinics. Some physicians may work in private clinics, while those who are not working in private clinics may get a non-practicing allowance payment. Some may receive informal payments by patients for free services as a way to incentivize better quality care. National Health Protection Scheme and Central Government Health Scheme are cashless and use smart cards as a way of payment. Public district and tertiary hospitals provide emergency care, maternity services, and newborn care. They are paid through an annual budgetary mechanism funded by either the state or central government. Private hospitals are on a fee-for-service basis and have no standardization of service price.
What share of health costs are borne privately for those who are insured? 36% of insured people have private health insurance that only covers hospitalizations. All forms of treatment, including outpatient care and medicines, are covered by the Central Government Health Scheme and Employees State Insurance Corporation. All secondary, tertiary, pre-hospital, and post-hospitalization treatment. There are no deductibles, co-payments, or co-insurance at public health institutions for citizens. Due to limited government funding, private clinics provide a large percentage of outpatient and inpatient treatment with prices generally paid out of pocket.